as intro music fades in then fades out slightly under the voiceover. Hello and welcome. Today we're diving into a serious and often complex topic: liver cancer, specifically hepatocellular carcinoma, or HCC. The liver, a vital organ responsible for filtering blood, producing essential proteins, and storing energy, can be affected by this devastating disease. We'll explore what causes it, how it develops, how it's diagnosed, treated, and what you can do to lower your risk. This information is intended for educational purposes and should not be substituted for professional medical advice. Always consult with your doctor regarding any health concerns. The development of hepatocellular carcinoma is often linked to chronic liver damage. The leading causes worldwide are chronic infections with hepatitis B and C viruses. These infections can lead to cirrhosis, a scarring of the liver, which dramatically increases the risk of HCC. Other significant risk factors include excessive alcohol consumption, non-alcoholic fatty liver disease, and NAFD, often associated with obesity and diabetes, exposure to aflatoxins, toxins produced by certain molds on food, and certain genetic conditions like hemochromatosis, which causes iron overload in the body. Hepatocellular carcinoma arises from hepatocytes, the main type of liver cell. Chronic liver damage, irrespective of the cause, triggers a continuous cycle of inflammation, cell death, and regeneration. This persistent cell turnover increases the likelihood of genetic mutations. These mutations can disrupt the normal cell growth and division processes, leading to the uncontrolled proliferation of abnormal hepatocytes. As these cancerous cells multiply, they form a tumor that disrupts liver function, compresses surrounding tissue, and can eventually spread to other parts of the body through the bloodstream or lymphatic system. The tumor also stimulates angiogenesis, the formation of new blood vessels, to nourish its rapid growth, further contributing to its aggressive nature. The incidence of hepatocellular carcinoma varies greatly around the world. It is most common in regions with high rates of hepatitis B and C, such as parts of Asia and sub-Saharan Africa. In Western countries, the incidence is rising, largely due to the increasing prevalence of non-alcoholic fatty liver disease associated with obesity and metabolic syndrome. Age is also a factor, with the risk increasing as people get older. Men are also more likely to develop HCC than women, although the exact reasons for this are not fully understood. Understanding these patterns is crucial for targeted screening and prevention efforts. In its early stages, hepatocellular carcinoma may not cause any noticeable symptoms. This makes early detection challenging. As the tumor grows, symptoms may begin to appear. These can include abdominal pain, particularly in the upper right quadrant, a palpable mass in the abdomen, unexplained weight loss, jaundice, which is yellowing of the skin and eyes, fatigue, nausea and vomiting, swelling of the abdomen due to fluid buildup, a condition known as ascites, and dark urine or pale stools. If you experience any of these symptoms, especially if you have risk factors for liver disease, it is essential to see a doctor promptly. Diagnosing hepatocellular carcinoma typically involves a combination of blood tests and imaging studies. Blood tests can assess liver function and detect elevated levels of alpha-fetoprotein, or AFP, a tumor marker sometimes produced by liver cancer cells. Imaging techniques, such as ultrasound CT scans and MRI scans, are used to visualize the liver and detect any tumors. In some cases, a liver biopsy may be necessary to confirm the diagnosis and determine the grade of the cancer. The grade refers to how abnormal the cancer cells look under a microscope and how quickly they are likely to grow and spread. There are several classifications of hepatocellular carcinoma, which are primarily based on the Barcelona Clinic Liver Cancer (BCL) staging system. This system considers factors such as tumor size, number of tumors, presence of vascular invasion, presence of distant metastasis, and the patient's overall liver function. The BCLC staging system is widely used to guide treatment decisions. Early stage HCC, stages 0 and A, typically involves a single small tumor or a few small tumors and good liver function. Intermediate stage CC, stage B, involves multiple tumors or larger tumors without vascular invasion or distant spread. Advanced stage HCC, stage C, involves vascular invasion or distant metastasis. End stage HCC stage D is characterized by severe liver dysfunction and poor overall health. Treatment for hepatocellular carcinoma depends on several factors, including the stage of the cancer, the patient's overall health, and the severity of the underlying liver disease. Treatment options include surgical resection, which involves removing the tumor, liver transplantation, which replaces the diseased liver with a healthy one, ablation therapies, such as radiofrequency ablation or microwave ablation, which use heat to destroy the tumor, transarterial chemoembolization, or TICE, which delivers chemotherapy directly to the tumor, targeted therapies, which target specific molecules involved in cancer growth, and immunotherapy, which helps the body's immune system fight the cancer. In advanced cases, systemic chemotherapy may be used to slow the growth of the cancer. A multidisciplinary approach involving hepatologists, oncologists, surgeons, and radiologists is essential for optimizing patient outcomes. Prevention of hepatocellular carcinoma is primarily focused on reducing the risk factors associated with the disease. Vaccination against hepatitis B is highly effective in preventing infection and subsequent liver cancer. Screening for hepatitis B and C and treatment for those infected can prevent chronic liver damage. Limiting alcohol consumption, maintaining a healthy weight, and managing conditions like diabetes can help prevent non-alcoholic fatty liver disease. Avoiding exposure to aflatoxins by properly storing and handling food is also important. Regular screening for HCC is recommended for individuals with cirrhosis or other high-risk conditions. The prognosis for hepatocellular carcinoma varies greatly depending on the stage of the cancer at diagnosis and the patient's overall health. Early-stage HCC that is treated with surgery or liver transplantation has the best prognosis. Advanced-stage HCC has a poorer prognosis, but recent advances in targeted therapies and immunotherapy have shown promise in improving survival. Research is ongoing to develop new and more effective treatments for HCC. One promising area of research involves developing personalized therapies based on the genetic characteristics of the tumor. Other research is focused on improving early detection methods and identifying new biomarkers for HCC. Clinical trials are also underway to evaluate new treatment combinations and strategies. Continued research efforts are essential for improving the outcomes for patients with hepatocellular carcinoma. Our outro music begins to fade in. Thank you for watching. We hope this information has been helpful. Please remember to consult with your healthcare provider for personalized medical advice.